I think that these people have had a unique opportunity to see certain memories being reflected back to them. And I think in some ways that's a wonderful opportunity. And on the other hand, it can make these people particularly vulnerable because they've been shown information that a lot of them don't know what to do with once they become aware of it, which I think lends them as wonderful candidates for psychotherapy, but I think it has to happen right away. I think they have to be given a support system, and they have to be given the opportunity to talk about what they felt and what they saw as soon as possible, as soon as they're finished with the end abuse treatment.
Since 1989, NDA International has provided dozens of medically supervised treatments for chemical dependency in Europe. These data, supported by animal research, has now allowed the Food and Drug Administration, or FDA, to allow the first human studies in the United States. FDA approval is provided in 3 phases. Phase 1, now being accomplished, are safety studies.
Gray is the whole blood.
Well, they can see how it's done. Here's the accelerometer. You can just rest it, misrest it. So like that.
The next 2 days, they would be using the machines.
Exactly.
These guys are electrolyzed. Right. This is not
They are?
visualizing it too.
Yeah.
Phase 2, which we hope to involve ourselves in the near future, are dosage ranging studies. Phase 3 would involve the providing of the end abuse procedure to a broader population base, possibly 300 to 1,000 patients, in order to determine, one, which groups will be most effectively treated by end abuse, and if there are any subgroups in the chemically dependent population which may not benefit or have a risk associated with them. Once end abuse is approved by the Food and Drug Administration, we hope to have thousands of hospitals and clinical facilities online to treat hundreds of thousands of persons who may wish to cease their chemical dependency.
With end abuse, you have a key, the ability to end your addiction in a 24 to 48-hour period with no withdrawal, plus with psychological insight as to why you got addicted in the first place, the underlying psychological reasons for your addiction. And there are so many pluses to the end abuse procedure as opposed to any other form of drug treatment, be it methadone, quinine, cold turkey. It's like comparing a Ferrari with a Volkswagen Beetle. And end abuse would be the Ferrari. You know, that's all I could say, is that it's the best treatment for the addict, I think.
In this society, I think we have to take a new approach to drug abuse and the way we treat it, because unfortunately in the United States, most of these drug clinics are created for purpose of creating jobs, and most of these people who are involved in these clinics are more interested in the paycheck than treating the people who were there. And I think we have to take a new look at the way we treat things. I mean, we have to realize in this country that most people think that once you abuse drugs that you can't come back, that we're not damaged, we're not evil individuals, we're just people with problems. We're people that can function, that can come back, and we're not, you know, I mean, as far as racism and as far as people going, you know, drug abusers are the lowest on the pole. And I think Ibogaine is the difference. It's a more humane, the end abuse procedure is a humane, one of the most humane ways of treatment of drug abuse. It gives you respect, it's treatment with respect. It's not making you feel like a dirty piece of crap like a lot of drug programs are. It's respect, it's with dignity, and I think that's what's the problem with drug abuse, drug treatment in America. We have to bring more dignity, more respect, And Ibogaine is the way I think we can do that.
There's a lot of people that when they hear about the end abuse treatment, they're afraid because they hear it's some kind of trip and they don't want to have any mind-expanding experience, because when you're a junkie you basically want to nod and you don't want to think. And a lot of people I talk to, they tell me like, yeah, but I don't want to see my life come by, because, you know, I don't want to think about my life. I especially don't want to see it all again, you know. I would like to say to these people, like, you're not going to see things you're going to expect to see. The things you're going to see are the repressed memories, which are usually the positive things. And, you know, it's worth it. It's worth to do it, because within 24 hours, you're out of this total horror that you're in, this slavery of every day having to hustle that money and, you know, having to make sure you're not getting sick. 24 hours of something that can really enlighten you and make sense of like why you got hooked, and, you know, give you some real like incentive to stop. I mean, why not, you know? Don't be afraid of it, because you're not going to see anything else but yourself. So why be afraid of yourself? You know, that's what I would say.
In summary, I perceive the ENDABUSE procedure as a very safe and non-threatening and effective way of interrupting chemical addictions, eliminating craving, eliminating withdrawal symptoms. I think that you have to perceive it as a symptom-free window, which will then require some psychological and social support in order to provide the best possible outcome and the maintenance of drug freedom. I don't think that the ENDABUSE itself, without support, will necessarily lead to total drug freedom over time, but it does provide that symptom-free window, which I think is crucial for patients with chemical addictions.
NDA International, recognizing the life-threatening nature of chemical dependency, is now in negotiation with several hospital and clinical facilities outside the United States to allow immediate treatment for those in need. These facilities will provide 24-hour-a-day medical treatment in hospitals to assure the safety and comfort of all patients. Additionally, we will use these facilities as a training ground for American doctors to allow the expedited development and approval by the Food and Drug Administration in the United States. Once this is accomplished, we can look forward to providing the ENDABUSE procedure to the hundreds of thousands of patients who are now slaves to addiction, to allow those who wish to be free that freedom.